This worldwide revolution really started more than 40 years ago. But it's still young and fragile. We want and need to continue changing some of the foundation stones of universal healthcare practices. But in order to make a real difference, it has to be sustainable in time, for all generations to come. And for this to actually happen, it really has to sink in our collective consciousness. A lot of lives have been saved, but so many deaths can still be avoided. The Uganda project is a prototype, and we sure hope it will become a model for the rest of the world.
Ready? Here we are again, in Africa and in particular in Uganda, this country we really love. This project, we conceived it in 2009, so it's more than 11 years. The most difficult has been done. We need to make change sustainable. We need to continue and pursue the effort. We could see the endorsement. We could witness people willing to change, which is very important. Without the people, we can do nothing. Uganda could be a model. This is a game changer in hand hygiene promotion in the country. We came here for the first time in 2009, looking for the best place to produce locally alcohol-based handrub. Because we were convinced that that was the only way to transform patient care at the bedside. Hand hygiene is the main key factor for infection prevention reduction. Now the problem of hand hygiene is that you cannot use soap and water hand washing. So the solution here is alcohol-based hand rub solution. The alcohol-based hand rub solution should be available at the point of every patient care. There's one here, there's one here. Alcohol should be accessible and it should be affordable. By far, the best solution is to produce alcohol locally. Bringing alcohol from Europe, from Asia, from the US was not consistent with what we wanted to do. What we wanted to do is really produce locally, make sure we would create jobs and save lives. Some students too, yeah. What has been fantastic is to identify the capacity to do local alcohol-based hand rub production. Allow us to visit and understand. Thank you very much. In 2012, we introduced alcohol-based hand rub that was not produced locally. The first alcohol-based hand rub solution was produced in 2014. And today, not only in the same factory, we are producing the alcohol, but the mechanics is here. So we have a machine that is producing 20 times the volume we used to produce.
Before the coming in of COVID, we were actually operating on a manual scale because of the demand which was not there. When COVID came on board, actually in the whole region, the East African region, Salah Manufacturing was the only facility which was manufacturing alcohol-based hand rubs. By luck, we had the funding from the people of Japan and also UNIDO, where we had to buy a semi-automated filling line. Initially, we were actually having a capacity of 1,000 liters per day in an 8-hour shift. Today, our capacity is 2,000 liters in just 1 hour.
Another aspect that is critical for sustainability is the diversification of the product.
Our product portfolio has increased and we are currently working on even increasing it to a higher level. The products that we are offering have increased over time, both for public hygiene but also consumer products on one hand. We are currently working on the GMP certification that will allow us to go into pharmaceutical production, and once that happens, it will even increase our scope in the IPC field much more when we introduce some of those products for our customers, both locally but also regionally.
Yeah, you can be proud. You can be very proud of yourself. So we are proposing to the people of Uganda the best product we can imagine, like in any country in the world, whether developed or developing countries. Second part of our mission was also to introduce the 5-mode implementation strategy. Of course, system change, making sure alcohol will be available everywhere where patient care is provided, education and training, monitoring the feedback and performance of the feedback,
You are in charge.
workplace reminders, and a safety culture around hand hygiene. Now, of course, to make all healthcare workers aware of the importance of the multimodal strategy, we have run this TTT, so-called Train the Trainers program, to train the best people in infection prevention and control in the country. We did it by introducing a study, the so-called Mikono study.
My local name is Wafula here in Uganda, which means born during the rainy season. Since 2008, I've been trying to do some activity related to hand hygiene and infection prevention control here in Uganda. The Mikono project is a cluster randomized trial to assess the impact of hand hygiene promotion and locally manufactured alcohol-based hand rub in healthcare setting across 4 districts in eastern Uganda. Hopefully we can continue to work with the Ministry of Health as well as JICA and Saraya so that we can cover the entire Uganda for better patient safety outcome.
In 2016, the Ministry of Health of Uganda asked me, why is it that you don't spread your campaign into the entire country? At that point, I told him, well, we are not ready. The hospitals are not ready. We want to test it before. Today, the Ministry of Health has sent people for training, and the Ministry of Health is asking us to go forward and to do it in the entire country.
At the Ministry of Health, we realized that we need to promote hand hygiene at all the different levels. We need to look at the leadership at the top, but also the leadership at the different levels, to collaborate with them to ensure that we have a system in place where hand hygiene can be performed easily.
It's more than a success. It's more than what I could have imagined in 2009 when you say, why don't we imagine to actually produce locally alcohol-based hand rub? We have everything we need. We have all the ingredients to possibly make Uganda the model country in Africa for the promotion of hand hygiene in healthcare. Thank you all for this fantastic achievement. Long life to Clean Care is Safer Care, so save lives in your hands in Uganda.